Good evening, everyone. Good evening. My name is Dr. Roger Mitchell Jr. I am the president of the National Medical Association, 126th president of the National Medical Association. I'm also the president of Howard University Hospital. Very excited to take a moment of your time, and I want to thank you for jumping on this webinar. Today, as you saw in the title, that when we talk about gun violence, we want to talk about gun violence not just through the lens of mass fatality. Last week, we had tragic mass fatalities all over the country, including the one that left a NYPD officer dead in his city. And so we wanted to, in the National Medical Association, understanding that gun violence is a public health issue and understanding how important it is to talk about gun violence every opportunity that we have. I wanted to pull together a group of experts. Not only are they experts, but they're friends and colleagues and laborers, both on the local and the national front surrounding gun violence. And so I wanted to have a conversation with them about gun violence, about how they've gotten to this space of gun violence prevention, the importance of looking at gun violence through the lens of public health, a little bit about how we can get involved as members of the National Medical Association and general members of the community in gun violence, and then how you can connect them and get involved. So just a little bit of a housekeeping. You can use the chat to ask questions. I ask that you be professional in your chat, be professional in your Facebook Live comments, and so that we can get to as many questions as we could possibly get to during the question and answer period. Those of you that are members and are in the Zoom holding room and can see this via Zoom, feel free to either use the chat or the question and answer icon. And we hope to get back to you. If we don't answer your question during this webinar, we will do our best to get those questions answered and get them to you, those answers to your questions. So without further ado, I'll ask for my panelists to come on camera. Mr. Greg Jackson. Mr. Greg Jackson is the immediate past assistant director for the White House Office on Gun Violence. He has a new position that he'll talk to us about at Rocket Foundation. And then Michael McGee, Dr. Michael McGee, who is an emergency room physician. He has been in this space of gun violence prevention for some time, and he treats patients that suffer from penetrating trauma, including gun violence. And so, thank you, gentlemen, for being here and being willing to be on this webinar. Each one of our panelists will have several minutes to talk, but first they're going to introduce themselves because I always like for them to give their introduction, and then we'll jump into questions. And first, we have Dr. Michael McGee.
Thank you, Mr. President. I'm very happy to say that. I must admit, you're the person who started this violence prevention initiative, and I thank you for what you've done and for you appointing me for this position as NMA Chair of Violence Prevention Council here at NMA. First off, my job. I'm an ER doc, trained at NYU, huge trauma center. My first job was at Emory and Grady, another big trauma center, but I hail from Gary, Indiana, which is what led me back when my mother passed away. I moved back to Gary, and it's a huge, big trauma center. I grew up in Gary. I've been around violence all my life. At one point, Gary had the highest murder rate per capita out of all cities in the country. In doing so, I grew up in a single parent family. I used to fight all the time. I've been shot at 3 different times. And so I've been around violence all my life. And so it was natural that once I became a board certified ER doc, that I would now go to my passion, which is trying to save youth, which is where I am, which is why I started POP on Youth Violence, which means Project Outreach and Prevention. As a practicing physician right now, I worked at Gary Methodist for about 10 to 15 years. I'm now at University of Chicago in Northwest Indiana as the medical director of the ER, as well as the president of the medical staff. But my background is actually in public health, epidemiology, and biostats. So I follow the numbers. I've been following the numbers for years and seeing that there's a huge major discrepancy in health disparity in terms of Black people dying from gun violence. We get super excited about the mass shootings that we hear, usually caused by a lone person with a lone gun that's killing people for no reason. But you guys should also know that mass shootings are 4 or more people who get shot or killed. That's not the shooter. So it also involves interpersonal fights and altercations that happen where people shoot each other. And subsequently, we have more of those happening per year because people are just have guns and they don't have any conflict resolution. And so here we are right now. And so we'll get more into that as we go through this webinar. But I do want to talk a little bit about my program. And I'm going to stop talking and actually show you a quick 1-minute video. And I should be under my 5 minutes at this point. So we will go ahead and show that video right now.
Youth tangled in a web of violence, an epidemic that doctors Michael McGee and Reuben Rutland want to help cure. In 2016, they partnered to create Project Outreach and Prevention on Youth Violence, or POP. Their goal is to reduce violent incidents by introducing youth to more positive experiences. POP engages with youth in Northwest Indiana and Chicagoland, from fun pep rallies and career seminars to intensive mentoring events, all focused on violence prevention. POP is a nonprofit organization that offers scholarships to minority high school students interested in medicine and positively motivates youth in juvenile detention, on probation, and in alternate schools. POP engages all youth in conflict resolution skills and promotes discussions about the long-term effects of violence and creating healthier neighborhoods. Not one more life, one more day. POP on youth violence.
One more life, one more day.
Thank you, Dr. McGee, and I appreciate again your service to not only the National Medical Association, but nationally through all of your work that you're doing. Next up, we have Mr. Greg Jackson. Mr. Jackson, please introduce yourself.
Yeah, well, thanks for having me. Greetings, Mr. President. Congratulations again. And thank you to the National Medical Association for including me. I started in this work and in this movement as a survivor first. Unfortunately, in April of 2013, I was caught in the middle of a crossfire, and a bullet that hit me hit 2 arteries, nearly costing my life. And since then, you would have thought that would have been the harshest moment, but since then I lost a family friend, Trey, to violence, and then 2 of my mentees here in Washington, D.C. were both killed by gun violence. And so, unfortunately, since that moment, I've been an outspoken activist, but have seen the need and the urgency to take action more and more with each of those tragedies. And so I started by just sharing my story, working at the local level, helping to develop the violence prevention efforts here in Washington, D.C., where I live. But then when my childhood friend Trey was killed in Greensboro, North Carolina, I really saw the huge contrast between what's happening in our big cities and in our smaller cities, especially in the South. And so pivoted to national advocacy, joined the Community Justice Action Fund. We advocated for federal policy to invest in violence prevention programs, to crack down on some of the folks who are frankly profiting off of the violence in our communities. And in 2022, we were successful in passing the first law on gun violence in 30 years, the Bipartisan Safer Communities Act, which I'll speak a little bit more about later, but invested $15 billion into violence prevention and passed some really key legislative policy changes. So after that, myself and an amazing team, the Black and Brown Peace Consortium and the Fund Peace Coalition and the Invest in Us Coalition, about 500 organizations, all pushed the White House to not just pass a bill and sign a bill, but to fully implement it, recognizing that lives are being lost so urgently. And so the White House turned around and said, well, if you got all the energy, why don't you come get it done? And so joined the White House in September of 2023 and served there, 2023. Whew, time is weird. And served about 420 days in the White House implementing that legislation, but also helping to develop new ideas and new solutions to address violence from the White House and federally. And so that's a little bit about me. I'm from a small town called Fluvanna County, Virginia. Grew up hunting. I'm a gun owner as well, but recognize there are real public health solutions that can prevent violence before it happens, and that even gun owners should push, and I think are, frankly, across America, supportive of common sense legislation to make sure we have responsible owners across the country. So thank you so much for having me, Dr. Mitchell.
No, I appreciate it, and again, these two men know gun violence from their own personal experience as well as through their profession. Just a little bit more about myself. I'm a forensic pathologist and been serving as a forensic pathologist before my role as the president of Howard University Hospital. And the majority of what I saw was gun violence on my autopsy table. Young black men, young black women, where I had to remove bullets and count bullet wounds, and create an environment where I had to provide closure to families. And so I started my career in the FBI. I was an FBI forensic scientist, one of the first black men in FBI laboratories before medical school, and left the FBI to study gun violence as a public health issue. Um, and so this notion, and this was the late 1990s. I'm going to ask Dr. McGee to come back on because I have some questions. But this was the late 1990s. This was like 98 that I started medical school, and that the in about 96, David Satcher had put out the Red Book, right? He had put out this guide to youth violence prevention. I still have one of the original books. It's all beat up and marked up on my desk. So the first question I have for both of you, and I'm going to start with you, Greg, is, why are we talking about gun violence as a public health issue? Why is it important? And I understand that you're not a public health official. You're not a physician. Here we go. Here we go. Come on and tell me.
Not yet.
Um, but you've had the ability to even be part of Office of Neighborhood Safety and Engagement in Washington, D.C. You have built programs that really center the public health model. So tell me why should we be thinking about gun violence as a public health issue? And then I'm going to go to Dr. McGee right after you.
Yeah, I said not yet because I'm getting my master's in public health right now in Yale. So
Oh, man.
I got class.
Oh.
I got class tonight, so I'm trying to get the degrees to catch up with the work.
I love
But
it. I love it. I love it. I love it.
but no, I mean, when we think about this as a public health crisis, the numbers are so obvious, right? I think we've been reacting to the media and the press around mass shootings, but we often overlook how big this crisis is. And so I just want to lay out some really important stats for everyone to internalize that gun violence is the #1 cause of death for youth in America, all youth. It's been the #1 cause of premature death for Black youth since 2006. It is the leading cause of death for Black men under the age of 44, the second leading cause of death for Black women and for Latino or Hispanic men under the age of 44. Most recently, it has become the leading cause of death for pregnant women in America, ahead of childbirth complications. And it's also recently become the leading cause of newly disabled Americans. And so when we think about this crisis, this is no longer just the inner city challenge or something that's connected to other felonies. Now, 1 in 5 Americans know someone who's been shot or harmed by this. And when we think about a public health crisis, we think about what is really devastating the healthy lifestyle of Americans across the country. And this right now is outpacing automobiles, it's outpacing so many other forms of health issues across our country. But yet we don't have the full public health response. And thankfully, during the Biden administration, we were able to get the U.S. Surgeon General to release the first public health advisory acknowledging this issue as a public health crisis. which is a huge, huge deal. And we know even with tobacco and automobiles and other health crises, that advisory is where you saw efforts in the health world really ramp up historically. So we have that starting point. But we need to really push for an all of society approach. And thankfully, the Biden administration pushed for an all of government approach, invested billions of dollars, invested in major policies, but we still need to build out that infrastructure at the state and local level. And we also need to recognize that Trump is doing everything he can to dismantle the beginning of a public health response across our government.
Yeah, thank you for those stats. And because I don't think a lot of people understand the impact that gun violence is having. And a lot of people think about gun violence as just homicide, but gun violence is also suicide. And in fact, the majority of individuals that are dying by gun violence are suicide victims, are individuals that are utilizing the gun to kill themselves. And I think it's very important to illustrate that gun violence is both suicide and homicide, both against that person and against themselves. Why? Because the demographics of those that find themselves the victim of suicide is increasingly white men, and those that find themselves victims of homicides are Black men. And so that gun violence is something that affects all communities, not just one community. And that's one of the reasons why it's a public health crisis. Dr. McGee, you are in the throes of things. I mean, listen, you even have your uniform on right now. Part of the conversation we had last week about when these mass shootings were happening, and when I got you guys on the line and we said, when can we do this? You said, hey, listen, I got National Night Out on Tuesday, and then I'm on call, in the emergency department, on Thursday and Friday, and so I got Wednesday that I can do this. Talk to us a little bit about your lens and how you view gun violence as a public health issue.
Let me add one sidebar to what you just said about that mass shooting. That night when we talked, there were approximately 4 mass shootings that night on July 28th. Do you know that the day before that, there were 5 mass shootings? And in a 12-day time span, there were 25 mass shootings in 12-day time span. So these mass shootings are affecting any and everyone. They get a lot of attention, but the situation that has been going on for years, which are young Black men dying, has not gotten the same attention. The way I look at gun violence, it's the same as COVID. COVID and gun violence in Black communities were the same disease. They both was like a virus that's been spreading. They both were out of control. They both were expanding at a huge click, and they both affected a bunch of Black people. We now know that Black people make up 14% of the population and accounted for over 52% of all COVID deaths. Well, we also now know that Black men aged 10 to 34 make up only 6% of the population, but account for over 52% of all homicide victims. To me, that's public health at its finest. It's showing you a group of people who are dying for no reason for no whatever reason that we know that can be controlled. That there's the resources not being placed to make the changes, to give the jobs, to prevent the guns from getting into the neighborhoods, to educate our people about guns. And we also mentioned that suicide and homicide are the top killers and the reasons for gun violence, but we also tend to miss the unintentional injuries, where we now have another whole epidemic of kids under age 7 dying from getting their own parents or their brothers' guns. So now that's the next situation that we're having. And in closing, and upon the theme that I'm saying in terms of why this is such a huge public health problem, I just want to show you a quick video to show you what I see when I'm out with all these youth in all these different cities and all these different schools who all show and raise their hand when you ask the question, do you know someone who's been shot or killed from gun violence? It will truly touch your heart and make you want to act. So let's show that quick 60-second video right now.
A 19-year-old student was shot.
Just last night, 4 people were shot.
40 people were shot. Overnight shooting.
Mass shooting.
Chicago just experienced its most violent Memorial Day weekend on record.
can't let them take my soul.
Look around. Look around. That notion that you can be in groups of young people throughout multiple schools and ask, look around. If we could stand up and wouldn't cause disruption in this Zoom, if you were to ask that same question, I think we would all raise our hands, right?
Yes.
Because this epidemic is an epidemic that is really gone untapped. And one of the things that you said, Mike, Dr. McGee, is, you know, we don't know, right? And what I translate that is that there's been limited dollars, limited research surrounding gun violence. And when we talk about the dollars that are in the Centers for Disease Control, the dollars that are being used at the National Institute of Health, we're talking about a fraction of the dollars than those that are being used to study cancer. And some might say that cancer is more important, but gun violence is not just the number one killer of Black adolescents. It's the number one killer of all adolescents, no matter the race.
Correct.
And so if we are going to have a future in this country, we need to grapple with our love affair with guns and the fact that we are not doing the things that are necessary to truly understand and prevent gun violence. Greg, you know, I was so proud of you. Greg and I have known each other for many years, both of us, before we could get on a Zoom and have a conversation like this. And your history and what motivates you and the work got you to probably the biggest platform that gun violence prevention has ever had, and that's at the White House and that White House Office of Gun Violence. Talk to us a little bit about that work, some of the successes, maybe some of the unfinished work that might be still out there for us to do. Tell us a little bit more about that work at the White House Office of Gun Violence that, quite frankly, has been completely demolished and taken away under this administration.
Yeah. Well, you know, I give all the credit to the survivors, the activists, and really the courage of President Biden and Vice President Harris to create this for the first time in history. And, you know, we were a part of a series of actions that were done to address this huge health crisis during that time. And folks may not know this, but in the pandemic, we saw the steepest increases in homicides in American history. And as Dr. McGee said, there was a direct correlation between COVID and gun violence, right? We saw the risk factors of gun violence go through the roof. Economic instability, lack of opportunity, folks trapped at home, not necessarily having safe spaces in their neighborhoods, and so on. And that drove the numbers through the roof, even though other forms of crime stayed stagnant or actually went down. And so when we started the office and really throughout the administration, the focus was on how do we address the risk factors that lead to violence. And we focused on two major areas. We recognized whether it was suicide, a mass shooting, or community violence, interpersonal violence, it came down to two major things. Someone is in a moment of crisis and decides to pick up the gun in that moment of crisis. And so we focused on how do we address those two areas. And a couple big things we did to address the moment of crisis is we invested $42 billion into violence prevention programs Between the Bipartisan Safer Communities Act and executive action, we actually pushed America to the gold standard for youth mental health. We created the 988 call system for suicide and moments of a crisis. I think everyone is probably aware of by now. Over 10 million Americans have used that. That was a gun violence prevention response tactic. We also put $1 billion into our schools to help improve learning environments to help address the crisis of violence, both in spending funds for school-based mental health professionals, but also for after-school programs, therapeutic services, and beyond. In addition, though, we looked at community violence intervention programs that work in our communities and made major investments in that. $2 billion from the COVID Relief Fund, about $400 million came out of the Bipartisan Safer Communities Act, but looked across government and figured out what grants can we pour into these programs that we know are doing street outreach, but frankly, scientifically impactfully, most of them were doing some form of cognitive behavioral therapy. And we know that that's the leading way to deal with mental health disorders in our country, or any type of mental health crisis, is helping people shift their lifestyle through small tweaks to create ultimately larger behavior changes. And that's what CBT does. And many of these organizations do that, whether they're hospital-based, doing street outreach, they're in a classroom. So we poured resources into those community violence intervention programs. And so those are just examples of things we did to help prevent that moment of crisis from happening in the first place. Then the second side was, how do we make sure that gun is not available to those in a moment of crisis? And again, as a gun owner, there are so many people out here who are responsible in their ownership, but right now it's too easy to access a gun. And Dr. Mitchell, you talked about the 90s. In the 90s, when we saw the last big surge of violence, we only had 100 million guns in our country. Now we have 400 million, right? So 4 times the guns. And while we may not have that same drug crack epidemic, we have a ton of firearms in the hands of our communities. And when you look at homicides, especially in the Black community, the majority of it is not connected to crimes. It's not connected to gang violence. It's really connected to interpersonal conflict and these moments of crisis. And so to address that, we looked upstream and figured out, how can we prevent guns from even getting into the hands of those that are most vulnerable or most at risk in the first place. So we started by rolling out a zero tolerance for gun dealers and sellers, that if you violate the law, you lose your license. And we shut down over 400 gun stores. More gun stores were shut down under the Biden administration than the previous 20 years, right? We also made gun trafficking a federal offense. And believe it or not, before 2022, gun trafficking, you would just get a fine or a letter. And we found people that had trafficked over 100,000 guns and just were eating the fines, right? But we know that those are the guns that have the shortest amount of time from sale to a crime scene. So we made gun trafficking a federal offense and prosecuted over 300 individuals who were trafficking. We also improved our background check system, that if you're under 21, before your purchase is approved, we will look at your mental health records, and we will look at your juvenile criminal history to make sure there aren't any major flags there. We also know that red flag laws are a big tool to remove a gun from someone that's in a moment of crisis, whether the family has recommended it or the courts. And so we put $800 million into funding to support states that have those laws to build out and implement that. And so those are just a few examples of how we really focus upstream. And I'm sorry, 2 more quick ones. You know, we actually cracked down on illegal guns that we know are causing more harm. We shut down 350 websites that were selling Glock switches in the US. We also shut down the largest manufacturer of ghost guns, and recognizing that it's not just guns in general, but there are definitely guns that are more lethal, that are more likely to be used in criminal activity or to harm others. And so we made major efforts to crack down on the illegal gun world. And I will say that those 2 approaches were what we did. But again, we did 54 executive actions, the first bill in 30 years, moved $42 billion. But I think what's most impressive is that in 3 years, we saw a 31% reduction in homicides and a 20%.
Whoa. Say that again. Say it again.
31% reduction in homicides. And in cities with over 1 million residents, the average reduction was over 40%. And I'm sure everyone's seen like the social media posts and the news about, look at this city, violence is down, violence is down. A lot of that started years ago because of these major policies. And obviously we have really amazing mayors and local leaders that built on that momentum. But we are seeing tremendous reductions. Literally the steepest reduction we ever saw in history was, I believe, in 1994 or 96, excuse me. And it was about a 9% reduction. We saw an 11% reduction, and a 12.6% reduction, a 9% reduction. And then this year, we are on pace for a 20% reduction in homicides. So we have crushed those records 3 and now potentially 4 years in a row as a result of those policies. And as devastating as every moment of violence is, that it's not an accident that violence is down. It's not a question or mystery. There's direct policy, direct resources, and now we're at a point in history where we know we have a playbook that works, right? We're seeing it work across the country. Unfortunately, Trump is trying to dismantle that playbook, but we already have the proof. And now we can just figure out how to scale and share that and rebuild it and implement it at the local and state levels. But I mean, I'm so honored to be a part of that legacy, and I want to make sure I roll that out to y'all.
No, and I appreciate that. And just a reminder that the National Medical Association is a nonpartisan organization that educates community and the issues that are facing our community. And tonight, if you're just joining us, we're talking about gun violence, and we're talking about it not being just mass fatality shootings. And I'm Dr. Roger Mitchell, the president of the National Medical Association, joined by Greg Jackson, the immediate past associate assistant director of the White House Office on Gun Violence, and Dr. Michael McGee, emergency room physician, chair of the Council on Gun Violence Prevention for the National Medical Association, and a advocate and a grassroots provider of violence prevention. And so we heard from Greg, Mike, about what he's done at a policy level. But let me tell you, no coaches throw touchdowns. No coaches throw touchdowns. The quarterback throws the touchdown. So the coach can write the plays, they can create the environment. But if we're not doing the work on the field, if we're not running the plays the way they've been designed to play, to run, and seeing the field for what it is, then there's no touchdowns. And you're a quarterback. You're a quarterback. You're on the field. You're throwing touchdowns every day in this metaphorical world of gun violence prevention. Tell us, and you've shown us some videos that have been very, very stimulating to this conversation. Tell us a little bit more about what you're doing on the ground surrounding gun violence and what POP is doing to curb this public health issue.
Real quick, we have 4 pillars. The first is just public health awareness. We talk to parents and youth about gun violence, the statistics around it, and try to get them to see where the problem is and where the impact is made. We teach everybody how to stop the bleed. The second thing is we try to empower our youth. Youth is the answer, right? So we invested in SAVE, which is Students Against Violence Everywhere, also under Sandy Hook Promise. We try to teach youth in schools, junior high, high school, elementary, how to be leaders to prevent violence. The third thing is we have a shortage of Black doctors. So my first responsibility is to try to create more diverse, young Black, Hispanic doctors to enter the field. And then the fourth is intervention and healing. And we're going to show you an example of why the funding that Biden gave, which was one of our grants that we got from the Department of Justice, works. This video, as she teases up, will show you the 12 kids, youth, with gun charges on probation that we impacted and changed their lives. Our program was innovative. It changed 77 youth that came through. Only 7 of them went back into the system with gun charges after this program. So let's show that video real quick. Hugely impactful.
That's you? Who was that?
No, that's my brother.
He passed away. If you guys are robbing somebody, you may shoot that person. They may shoot you. Also, y'all gotta think. All the people watching y'all on TV, when I say y'all, I mean all youth, there are people who got guns legally who's scared of y'all.
You know, like a lot of people I be trying to convince, tell them like this life ain't for you. You know what I'm saying? Because I see a lot of people, like I ain't gonna throw no subliminals and shots, but I know a lot of people, like you can tell they soft.
And I know y'all had y'all guns for y'all, whatever reasons y'all had, but at the end of the day, y'all shouldn't be having guns. because it can result in some really bad consequences. It's a problem that's happening nationwide, and a lot of kids y'all age dying for no unnecessary reason. You want to tell them what you do? You guys go in there for a minute.
So everything that we do two views to a flat view and then a lateral, which is a side view. So say you were shot, if you saw a bullet in here, you would only see it on the flat part of your hand.
So what we're gonna do right now, we're gonna go walk all the way down, look at the rooms. We'll say hi to the nurse's station and come back around. We'll end up in there. That's our trauma bay. So man, this is the trauma bay where it all goes down.
And it does go down.
Oh, big time.
Typical day in the ER. It could be quiet and you can blink your eye, and excuse my French, it could be all hell break loose. I was literally at work one day and my own family member came in shot. We working, but I'm at the foot, so I didn't see the face. I made my way to the top, and when I saw who it was, I freaked out. Like, I really freaked out. And while he had a gunshot wound, I had my finger in his gunshot wound, controlling the bleed.
That's the heart right there?
That's the heart right there, and these are the lungs. So you'll see them inflating. You see how they're moving?
We're going to do a tour of the whole building. You guys are going to see some things, and yes, you're going to smell some things as well. So we're not wearing masks today because you need to be involved in the process of what we do here. What do you think that bag's for? That's for children. This would be your home for a few days. This is a full-size. But this is our holding for the folks that are going to be autopsied the next morning.
This male or big boy?
This is a male. This male is 61 years old.
My question would be how do you put up with this every day? Like, what keeps you motivated and going?
And we have to show your mom your body in that bag.
Do y'all show them with the pictures, like with the gunshot wounds?
Sometimes we have no choice. They have to identify you.
So with 4.6 million people with guns, and a lot of people don't lock their guns up, and they leave them out, and these kids know where they are. You know, and I asked the last group, where'd you get your guns from? They all said from a family or friend.
So before we move into the next question, Dr. McGee, talk to us a little bit about that end part. I saw the young people, they were working on, a dummy, or they were packing something into an item. I know what it is, but tell our audience what that is and how important it is.
Well, real quick, that's just the strategy that was started in 2008 under the Obama administration, which was to teach anyone and everyone how to stop the bleed if they were shot in the arm, the leg, the neck. Because a lot of people can die from a simple gunshot wound to an extremity. And people don't realize that you only have so much amount of blood in your body before you bleed out. So we teach any and everyone how to do that. We also put it on a little bitty business card with the QR code that we will share later.
No, and I appreciate that. And before we go into the last couple of questions, we have a special guest, that I was able to meet when we were in Chicago at the National Convention, and she's here to tell us a little bit about her story. I'm going to let Dr. McGee give her a quick introduction. but Chloe Gilder's here, and Chloe is a friend and soon to be colleague of the National Medical Association. So, Dr. McGee and Chloe, if you would join us on screen, that would be great.
So Chloe is only 23 years old, but she's wise beyond her years. She is a graduate of University of Illinois in Urbana-Champaign. She is receiving a master's in bioengineering, and she is on her way to becoming a physician. She was one of our speakers at our healthcare fair on July 19th at our NMA conference, and she just opened a lot of eyes, and a few people shed some tears. So Chloe, why don't you come on and introduce yourself and tell a little bit about some things that happened to you in your life.
Hi, everyone. I'm Chloe, and a little bit about me. As Dr. McGee said, that last summer I was shot, and it was an extremely severe gunshot wound. It struck my back, and it hit my spleen, my pancreas, my stomach, my rib cage, my liver. It was a very dangerous surgery, and it was a miracle that I survived. Thankful for my surgical team. And within a month, I was able to begin my master's program and work alongside Carle College of Medicine to innovate surgical tools to improve laparotomies for a similar surgery that I got that saved my life. And during that traumatic time, I remember just having so many Black physicians on my team that gave me such representation and a sense of comfort that stuck with me. And it made me want to be able to have that same type of advocacy for patients in the future. So as I apply for my study for my MCAT, I'm applying to medical school in this upcoming cycle.
Chloe, thank you for that. And I mean your story is one that is amazing that you're here, but now you want to be a physician. What should people know about gun violence and its effects? And what should we be doing for gun violence?
Yeah. So what I would want people to know about gun violence is that it's not just a headline or statistic, but it's actual real lives, real families, and real communities being ripped apart. I remember trying to return back to my life, and I was entering into these professional spaces, and one of my peers told me that I was the first person he had ever met who had been shot. And that moment really stuck with me because here we are, the same age, from the same city, we go to the same college, but our realities were worlds apart. I've been to more funerals than I can count. I've watched classmates never make it to 21. I've seen brilliant minds end up with long prison sentences. So gun violence has affected me way before I ever got shot. But people outside of these communities, that reality can be shocking. But for us, it's like a lived experience every day. So I would say the biggest mistake we make is treating gun violence like it's a them problem when it's really an us problem. Like no matter if I went to school or not, like me being integrated into my community still had an effect um on how I experience gun violence. Until we see it as our collective issue, we won't really make change. Guns are being glorified as symbols of power and strength and just among our youth alone. And in this process, people are becoming desensitized to the destruction that it's actually causing. And when I see my own neighborhood, I see that I live among hardworking families, children, elderly, blue collar workers, but it's the few causing harm that paints our neighborhood in a negative light. And this only brings down the value of our neighborhoods and put more lives at risk. But I want to suggest that instead of focusing on the few who commit the acts of violence, I'm more concerned of the systems that have continuously failed them. I don't come from wealth, but I still understand my privilege because when I see my peers are growing up without basic necessities, whether it be food security, family support, or adequate education, I want people to see that our communities aren't broken, but we are underserved. And what we need isn't more punishment, but resources and healing and just opportunity. And gun violence, it doesn't just affect individuals, but it affects all of us in one way or another. So until we address the root cause, it's just going to keep repeating itself.
Thank you, Lord. Totally
Thank you, Chloe, and thank you for that. And I'm hoping that everybody that's listening understands that what Chloe is saying. So, Chloe, keep it up. Thanks for taking some time with us to share your story. This won't be the last time we have you connecting and motivating people. And you know, if you want to sow into Chloe, if you want to make sure that Chloe has what she needs in her pursuit of medical school, reach out to the National Medical Association. And we will make sure that Chloe gets the support that you're trying to provide because this is a young lady that we have to make sure gets to the final destination, gets to the place where she's a physician and she is not only saving lives with her medicine, but saving lives with her words, her emotion, and her lived experience. So everybody that's in the chat, everybody that's here, please give her a round of applause.
Thank you so
And
much.
Dr. Mitchell, she is also applying to Howard University for medical school.
There it is. There it is. And therefore, my job is to advocate for you, Chloe.
Letter of recommendation.
Absolutely. Absolutely. 100%. We got it live
got
on
you too,
Facebook.
Chloe.
We got it live on Facebook. Absolutely. Absolutely. Thank you, Chloe, for joining us.
Thank you.
Gentlemen, we have a couple minutes left. And I'm going to give you some time to incorporate a couple of these last questions. There was one question that, you know, and you answered them via the open chat. But tell me a little bit about why is it important to think about this beyond mass fatality? And also, if there's several people that are watching this live, there's 51 participants here in the Zoom space. There's probably hundreds and hundreds, and we're recording this and it's archived and it's going to be on the website www.nmanet.org. And so there's, you know, there at the end of the day, there'll be millions of people that see this. Tell us a little bit about what we should be doing. What should we be doing? If we're a physician, if we're a legislator, you pick it. If we're an advocate, if we're an activist, what is it that we should be doing? How do we get involved? I'm going to go with you, Michael, Dr. McGee first, and then I'll go with Greg. And then boy, that hour went fast. It's 7:54.
In 2 minutes, we can show a few graphics. First off, we've already started it, right? At our last conference on the 18th, we had a all citywide health fairs and gun safety awareness workshops. We were at Rush in Pilsen. We were at UIC. We were at University of Chicago. We were also at Apostolic Faith Church. And at every one of these sites, we had a mini healthcare fair to assess the community needs, but also was having parents and youth learn gun safety tactics in terms of how to stop the bleed, also how to do CPR in case someone collapsed, but having important discussions about gun safety and protecting our youth. A lot of these kids who are getting these guns are getting them from homes, from their brothers, from their sisters, from their family members who are in some cities 18 and get a gun without a gun permit. This is real. We went from 21 states to now 29 states where the minute you turn 18, you get a gun. So let's start protecting our kids. Let's start doing those things. Let's give out gun locks. And so that's easy. Physicians can be doing this wherever you are, whatever city you're in. You could be organizing these same things that we have here. And we plan to do this on an annual basis in the cities of Chicago. But at every conference, we're going to do the same thing. And at every conference, we're going to do the same thing and have all the different centers and the community coming together to run the same workshops. We're also giving out these crisis cards where kids can have numbers to call in case they have a crisis for mental health or domestic violence or whatever issue they have. Let's have the same thing in the city that you're in, specific to your city, but then also the Stop the Bleed video here, which teaches anyone how to stop the bleed in 11 minutes. Moving forward, the next slide just shows you our strategy for Violence Prevention Council. If we can move forward the slide, basically, we want to be advocates with Congress. We want to work and get the right people in place. That involves voting for the right people to address the needs we need to address. We also want to work with the National Organization of Black Law Enforcement and any organization that wants to resolve gun conflicts and conflicts in general. We want to promote community policing. We want to have, credible messengers to deliver the message about safe gun storage, about protecting your kids and learning these techniques. And so that's the way to do it. We want to partner with the NBA. Why can't we have an NBA superstar having little infomercials and PSAs say, hey guys, let's show more unity. Let's care about each other. Let's not be the reason why you're getting shot is from an altercation, which, by the way, is the #1 reason for why people get shot or killed. FBI homicide data is showing that people are getting into fights, and because they have guns, people get shot. And this is happening in our own families. In Chloe's case, she had a situation in her own family where they had a family get together, an argument broke out, 3 people got shot, including Chloe. This happens far too often in all of our Black communities. Let's show more love. Let's show more unity. And yes, let's show more faith. And so we want to do these things and try to do better at what we're doing. And the last thing is our blueprint. We're trying to target 4 cities that we're going to work with, which would be Chicago, DC, Detroit, and Gary. And we now want to implement some of the programs that we have planned from NMA's perspective. I'll stop there. You can take a quick snapshot of that, but that's our plan. And we want to expand to other cities. Thanks for the time. Appreciate you.
So thank you for that. And Michael, I was just in Cincinnati. I was at the National Pharmaceuticals Association's national meeting. And while I was in Cincinnati, I met with several leaders in Cincinnati, the president of the Cincinnati Medical Association, the NMA affiliate, and several of the individuals that are working on violence prevention related activities. Okay. I told him that I'm bringing Michael McGee and the Council on Violence Prevention to Cincinnati. They're very excited. And so if you are here and you are anywhere in the country and you want some technical assistance surrounding violence prevention related activities, please make sure that you reach out. You can email me, president@nmanet.org. And we will make sure that you get in contact with Dr. McGee and making sure that you can start your violence prevention activities and your violence prevention work in your city using this blueprint that works. And so we want to make sure that you do that. Greg, tell us a little bit about, if you're a physician on this call, if you're an activist, you're an advocate, if you're a parent on this call, how should people get involved? What should people be doing?
Yeah, I would say there's 3 major areas I'd emphasize. One is if you're a gun owner, practice safe storage. We found that 76% of school shootings, even though it's only 1% of gun-related deaths, the guns come from the home. And youth suicide, 80%, the guns come from the home. And so safe storage is a practice that we should be pushing, educating anybody who walks through your hospital doors. We can talk about screening it. We can actually use Medicaid now. You can use Medicaid to screen people around their gun safety behaviors. But that's a huge one. The second one is that every hospital should be invested in hospital-based violence intervention and have folks in their hospitals that are working with those who have been harmed or traumatized. They should also look into having victim advocates that can sit bedside with someone who's been shot or harmed to make sure they're getting the support they need, and also to cool down in these situations so they don't retaliate in that very fragile moment. And the third big thing is that we know that access to trauma care, access to cognitive behavior, and just traditional therapy there are huge disparities amongst those who are being impacted by violence. And anyone that's in the healthcare space can advocate to make sure that access to trauma care, mental health care, and therapeutic care is as easily accessible to communities and individuals most impacted by violence. And lastly, I'm now the president of the Rocket Foundation. We were founded by Quavo and his family after the loss of Takeoff from the rap group Migos. And a big focus of ours is shifting the culture, but also investing in elevating community-based solutions like community violence intervention programs that we know can prevent and intervene violence before police show up on the scene, before a gun is drawn, before the criminal justice system is even involved. And we've seen tremendous success. And that's one big thing that you can do to push forward in your local community, or you can partner with us at the Rocket Foundation, rocket.foundation.org. And just most urgently, we saw 49 people shot in Atlanta last weekend. And so right now we're collecting resources for an emergency therapy fund that will provide therapeutic support for the victims who survived and for those who have been traumatized after suffering loss. And so if you would like to donate your dollars, we would encourage that, but go to rocket.foundation.org to learn more.
So I want to thank you, gentlemen. We've come up on time. We started a couple minutes late, so we're ending a couple minutes late. Want to thank you all. This is extremely important work. And today, when people are watching the news and the only thing that you can see is salacious material to distract us from the day-to-day work that we're doing in community, we at the National Medical Association wanted to make sure that our community knows that work is still happening. Advocacy is still happening, education is still happening, and the work on the ground surrounding violence prevention is still happening. And so those of you that want to get involved, those of you that think this work is important, want to do research surrounding gun violence prevention, want to do actual prevention, want to support, want to use your dollars for the Rocket Foundation or for the National Medical Association or for POP, there's opportunities for you to get involved. Don't sit on the sidelines today. This is not an opportunity in an environment where anyone can be sitting on the sidelines. We need you to get involved. And if it's not your talent, then give us your time. If it's not your time, then give us your treasure. And you can be impactful because we're out here doing the work. Again, I want to thank Mr. Greg Jackson. I want to thank Dr. Michael McGee. I want to thank the phenomenal and the impressive soon-to-be Dr. Chloe Gilder. I want to thank the support for the National Medical Association, Ms. Jennifer Young, who is our producer of this webinar, as well as our executive director, Joy D. Calloway. I want to thank all of the House of Delegates, Board of Trustees, and leaders at the National Medical Association to understand how important this work is and important the conversation is. So again, to continue this conversation, to get involved, to donate your time, your talent, or your treasure, please log on to www.nmanet.org for more information and how you can get involved. Thank you all so much. And there'll be a series of these webinars on different topics. We're probably going to be bringing you a topic on vaccines soon because there's a lot of movement that's happening surrounding vaccines and environmental and climate health because there's a lot of movement that's happening there. And NMA is on the cutting edge of this work. So thanks again, and we'll see you soon.